Apologies, everyone. Good afternoon, everyone. Welcome to today's regular press conference. Thank you for joining us today. We've got quite a busy agenda, so I'm not going to make too many introductions other than to welcome Lucy Whiteman, our Director of Public Health, Councillor Jonathan Nunn, the leader of Northampton Borough Council, Russell Roberts, the leader of Kettering Borough Council, Tom Beattie, the leader of Corby Borough Council, Councillor Fiona Baker, the Cabinet Member for Children's Services and Schools at Northamptonshire County Council, and Jason Smithers, Cabinet Member for Place and Home to School Transport. What we'll do is what we usually do. So we'll go to Lucy Whiteman first for her updated weekly report. Then I'm going to go to the local members for their views on the situation as they see it this week. Then we will come to some written questions which we've had from members of the press, and I'll go through those individually, and we will answer those as I bring them up. Then we can open up to some more general questions, if that's okay with everyone. If everyone could please use the hands up system for asking any questions, that would be great. And if everyone from the press could please rename themselves as the organisation they're from, that would be very helpful. So thank you very much, everyone, for attending. I'm going to pass now to Lucy Whiteman, our Director of Public Health, for her weekly update on the surveillance report. Thank you, Lucy. There is no written, we won't be showing the written report today because we are fine-tuning some of the detail on it, but we will be making that available after this. So Lucy will be talking you through that initially, and we'll be making it available as and when it's completely ready. Thank you, Lucy.
Thank you, Councillor Morris, and good afternoon, everybody. As Councillor Morris says, we're still awaiting the PHE notification of all of the statuses. People know usually that's published in the morning, and that's been delayed. So obviously our report subsequently is currently delayed just until we can update the narrative accordingly. But what I can obviously tell you is that the Borough of Northampton has seen a significant decrease in the number of cases since last week. And the data for the week ending the 30th of August is now showing Northampton Borough with an incidence rate of COVID-19 at 19.5 cases per 100,000 population. So a significant change in circumstance there, and down to the hard work of the various teams that have been obviously implementing and supporting a number of actions locally, but also the public who have just risen to the challenge tremendously with regards to both accessing testing and also adhering to those additional measures that we've been asking people to manage. So the picture elsewhere obviously is one that is changing, and we have in the last week up to the 30th of August had another 145 cases across the county, taking the total to 4,385. So 3 of those cases were identified through Pillar 2 testing, which, as we know, is that high-risk clinical testing process. 142 cases were obviously diagnosed through the more community-based local testing services and mobile testing units. So positive news in as much as it's a reduction in the number of cases since last week, but still more than we would want locally, and with a focus particularly on a couple of boroughs in the area. So the warning really is that COVID cases remain high across a number of the areas in Northamptonshire. From a point of view of the breakdown of those cases, there is a slight predominance of females coming through on the data, but we are still talking about largely working age adults. In the last week, there's an increase in the 20 to 29-year-old age group, but again, as I said, we're seeing cases across that whole age range. So it really is that the messages need to be being maintained and those actions sustained by the whole of the population. Northamptonshire as a county has seen a small decrease in its number of cases since the previous week, as I mentioned, but the county rate overall still remains statistically significantly higher than the national rate. In Corby, Kettering, East Northamptonshire and South Northamptonshire, we've seen an increase in cases on the previous week. I'm pleased to say in East Northamptonshire and South Northamptonshire, they're quite small numbers. However, in Kettering and Corby, those numbers are a cause for concern. Corby in the week up to the 30th of August saw 39 cases, while Kettering saw 34. So from a point of view of the overall rates for those areas as well, as I said, Northamptonshire remains higher than the national average. But now so does Corby, as well as Northampton and Kettering. Those two have been on that list for a little while, but Corby's significant increase in the last week has obviously pushed them up that rating as well. The rate of lab confirmed cases for different areas, we've looked at the pattern as people will remember over time. So overall, obviously, we've got a number of areas that are higher than both the England and the Northamptonshire average. But when we're able to share the data with you, you'll see a significant uptick in the cases in Corby, and that gradual increase that we've been talking about in Kettering continues at this point in time. From a point of view of outbreaks, we're still at a point where we've got 22 in the county. Those are 10 in the care homes. As we've talked about before, that's through the routine testing that we're seeing done. These are very small numbers and no cause for concern. And actually at the moment are demonstrating how we're able to proactively identify cases in staff and residents, very often who are asymptomatic, and then make sure that they're isolated and measures put in place so we don't see the same numbers that we did at the beginning of the pandemic in those very vulnerable populations. However, we have 8 workplace outbreaks, obviously the largest one being Greencore, that we're seeing the tail end of the data coming out of the Northampton statistics now. But one of the areas that is obviously increasing as well is exposures. So the definition of an exposure, just to remind people, is that single case where there has been or potentially could have been exposure to other contacts within that setting. So exposures tend to happen in places like coffee shops, gyms, bars, where you've got somebody who could be identified as a case, but who's been providing a public service. So it means that there's a risk that other people may have inadvertently been exposed to that case. Now, at the moment, those are monitored across all areas in the country by Public Health England, and we've had 55 exposures in the last 7 days. So some of those obviously are workplaces again, some in care homes and others in hospitals and hospices. So what we do is we then make sure we monitor that exposure and make sure that any subsequent cases in that area to see if there's a link, and obviously if there's a link then it becomes diagnosed or categorised as an outbreak. But those exposures are one of the key links between cases in some of the areas in Kettering and Corby. So again, one of those areas that we're going to be significantly watching, because as people come out, they go back to work. We've had the Eat Out to Help Out campaigns. There's a significant risk that exposures are going to be a root cause of onward transmission. So making sure we join up the dots there and are able to follow how an exposure then may end up limiting or causing, I should say, an outbreak. Key from a point of view of epidemiology and understanding the local spread. So public health actions, we continue obviously to meet on a daily basis. That's with Public Health England and all of our associated district and borough colleagues, both from an environmental health, licensing and communications perspective, and obviously with the police as well, who have been key in helping us enforce these measures. At the moment, with a change in some of the age groups that we're seeing an increase in the case numbers of, we're making sure that we refine our comms and engagement strategy accordingly, so that people not only get the messages around testing, which they're clearly hearing because of the rates of testing that we're seeing in the county, but also what to do if they're identified as a case. So making sure those messages around early identification and isolation, and then onward isolation for the 10 or 14-day period, dependent on whether you're a case or a contact, and then making sure that those messages around just generally as you go about your day-to-day business, and we do recognise people do have, essential travel they need to undertake, essential shopping, etc., that they do it in as safe a way as possible. So, Councillor Morris, if I stop there, then I'm happy to take any questions.
Thank you very much, Lucy. What we'll do is we'll come to the questions after I've been to the councillors, if that's okay. So I'm going to bring in Councillor Jonathan Nunn, the leader of Northampton Borough Council, first to give his views on the local response. Then I will go to Councillor Russell Roberts and then Councillor Tom Beattie. Jonathan, over to you.
Yeah, thank you, Ian. Thank you very much indeed. And I can only express what is the most overwhelming personal relief that we seem to be seeing some impact now on the figures in Northampton and the rates. That's absolutely fantastic. We have a little way to go, but without doubt, we've got to again stop and thank everybody involved, public health, NHS, the people at the council, such as environmental health, to our wardens and everybody, but above all, the residents and the businesses of Northampton for the most tremendous effort. If we've learned anything in the last few weeks, we have learned that this thing can be influenced. I'm reluctant to use phrases like beaten, but we're starting to get there, and it's all down to personal behaviour. So complacency remains our biggest enemy. That is to say, we must continue, in my view, being as careful as we have been with all the basic precautions, the additional stuff that we've come to live with in Northampton, such as avoiding public transport, avoiding car sharing, and so on. Don't be complacent. We're asking everybody, please, to keep it up. But what this does prove, and we'd pass this message on to the people of Kettering and Corby now who seem to be suddenly experiencing increased rates, you can change it, you can do it, but it's down to each and every person in each and every business and every home across the area. I think that's all I'd say for the moment. Tremendous relief that we've made some progress in. Thank you.
Very much, Jonathan. If I now bring in Councillor Russell Roberts, the leader of Kettering Borough Council. Thank you, Russell. You're still muted, Russell, sorry. There you are.
So I'd just like to add to what Jonathan said about that. We are experiencing a slight upgrade in the figures in Kettering. And it's disappointing, but we are also focusing very much on testing, because that's one of the tools that we can use to beat this. And we're promoting good practice. I think it comes down to a simple, clear message: wear your mask, wash your hands, and just be careful. And I think you have proved to us, Jonathan, that we work hard with a good, clear message out there with the people. And if we all pull together, we can beat this and get this turned around quickly. Thank you, Chair.
Thank you, Russell, very much. Councillor Tom Beattie, leader of Corby Borough Council. If I bring you in now, Tom.
Yeah, thank you, Ian. I just reiterate, really, I think what Jonathan and Russell have said. We've been pushing out some very positive messages in Corby for the last couple of weeks, as I know across the county we've been doing that. And it's disappointing and worrying to see the increase in cases. I'm not going to speculate. I'm not a public health expert as to why that might be. However, what I would say is similar to what my colleagues have said, to urge people to follow the guidance. That guidance is quite clear. And I think Northampton and the success that they've had in driving down at the high levels that they had recently is an example for us to follow, both in Corby and in Kettering. And I think we will continue to do that. Obviously, we wait to see what might emerge from government about what that might mean for us locally. But what I would say to people in Corby is that if we want to avoid any stricter regulations, if we want to avoid the disastrous notion of a local lockdown, then we have an opportunity to try and do that by adhering to the measures around things like social distancing, avoiding using public transport, sharing cars, hand washing, all that sort of stuff. I think those messages can't be stressed strongly enough, and we'll continue to do that. And I think that's all I'd like to say at this moment, Ian. Thank you.
Thank you, Chair. If I could ask everyone to mute themselves when they're not talking, that would be very helpful with the feedback. Thank you very much, Tom. I think one of the things that we can talk about is the success that we've had in terms of the numbers of tests as well. I think it's testament to the hard work that everyone has done in the area, and the very high levels of testing that we've been experiencing in the county. So that is very good news. I'm going to come now to the written questions. If everyone could mute themselves, I think everyone has now. Just checking before we carry on, otherwise it's going to interfere with the sound. I think so. So the first question was from Neil Barber at ITV Anglia, and I see you've got your hand up anyway, Neil. Can I bring you in to ask your question, please?
Yes, a few questions. One to Lucy, and then a couple to Councillor Roberts and Councillor Beattie. Lucy, do you worry about the increases in Kettering and Corby in a different way because there isn't an obvious centre of the outbreak like there was at Greencourt? And is that going to make handling this situation more complex? And to Councillor Roberts, do you think the people of Kettering are listening when they hear about increases and they see that an Imperial College London study said that there's a 76% chance it will become a hotspot? And to Councillor Beattie, how damaging would a local lockdown be to Corby?
Thank you very much, Neil. I will go to Lucy first, if I may, and then I will do in the order that you asked. I'll go to Russell and Tom Beattie. So Lucy, it's over to you for the first part of that question.
Thank you, Councillor Morris. So I think one of the things that people need to remember is that although there was a significant outbreak in Northampton, it was already an area of concern before the Greencourt outbreak actually happened. So we were already having to work with a sort of a community transmission issue, which is similar to that we're seeing in Corby and Kettering. So we have been able to take some lessons from those early days in Northampton and adapt and adopt them in Kettering and Northampton, obviously making sure that we're refining messages, as I said, so that they resonate more so with each of the different demographics that we're finding are having a high incidence of cases. So there are some similarities, but you're right in as much as a community transmission or a challenge around community transmission is more complex in its management. You know, if you have a smoking gun, you can push all of your resources at that one issue, whereas now we're very much reliant on the general public, obviously rising to the challenge as they did in Northampton, to adhere to those guidelines around social distancing and around best practice, so that we're identifying and then isolating the virus as soon as possible to stop any further onward transmission.
Thank you, Lucy. If I could bring in Councillor Russell Roberts and then Councillor Tom Beattie, because that was the order you asked in. So, Russell.
Yes, I believe Neil wondered if the people of Kettering were listening to the message. I think they are, and I think they've proved that because with an awful lot of them have come along and got themselves tested. And that proves to me that they are listening. And I think if we're now getting the message out as to make sure that you do the right thing, you keep yourself safe. And I think if we can get that message out there clearly, they will listen. Nobody wants lockdown. And as Tom Beattie said, this is our chance to stop that happening. So I think the people of Kettering, when we've given them a clear message, will listen and will act.
Thank you, Russell. Tom, I'll bring you in now, sir.
Yeah, thank you, Ian. The question was how damaging did I think a lockdown would be? It would be damaging. I mean, how damaging? I couldn't be specific. What would be more damaging, however, would be the effect on public if we don't get on top of the increase in infection rates that we're seeing. I think we'd want to do whatever we could to avoid a lockdown and the implications that would have on people's everyday lives, on businesses. All of that would have a damaging impact. I think we have a period here, we have time to try and ensure that we get on top of the situation so that we don't move to that damaging type of local lockdown.
Thank you, Tom. That's very true. Neil, thank you very much for your question. I'm going to move on now to Laura Coffey from BBC Radio Northampton. Laura, are you there? Hello.
Hello, good afternoon.
Good afternoon.
So I'd like to ask, with the rising cases in Corby amongst the community, is Lucy Whiteman disappointed that the local education authority has been unable to provide the sufficient bus capacity to ensure the 1 metre social distancing amongst students in different bubbles at Corby Business Academy? And on top of that, we were told yesterday by Councillor Jason Smithers that no other school was affected by this, but we found out since that this isn't the case, that 6 others are. So is this disappointing? I also wondered how many people have contacted the County Council to take up the mileage scheme. I know they're being encouraged to email in before they want to take their kids in by car. So how many people have contacted?
Thank you, Laura. Thank you very much for that question. Well, it just so happens that Councillor Jason Smithers is here as we speak. So I'm going to pass over to him to answer that question. But I have to say it has been a Herculean task to get this school transport organised. And I must commend the teams that have made this happen. So I'm going to go to Councillor Smithers to answer that question. Councillor Smithers.
Yeah, Laura, thank you very much for your question. Unfortunately, it was not possible to secure these additional capacity to ensure social distancing on all the routes to the Corby Business Academy for the start of term. But we did inform the school of this situation, and it soon became clear to us, when it became clear to us, should I say. But I'm pleased to say, as of this moment, that we have cleared this issue up. So all pupils will be able to get their transport, and they will be able to practice social distancing, which meets this authority's ambition to offer a high quality home to school transport service. And that is something that I'm exceptionally proud of the team. I know that there was an error at the beginning of it, but they have risen to the challenge to get it sorted, and we have got it sorted now. So regarding your question about the mileage take up, so we've had 23 people from mainstream education applied to the county for this scheme, and we've also had 12 from the SEN category as well. So it is quite low, but it is early days, and as I said, the team has worked exceptionally hard to get this back up and running to offer a good home to school transport service. So I don't expect we'll see those 45p claims being too high, because I'm confident that the home to school transport system will work as it should do next week. Thank you.
Thank you for that answer, Jason. I think that probably is the answer that was required. So I'm going to move on, if I may, to the next question, which is from Carly Odell. Sorry if I've pronounced your name wrong, Carly, at the Northampton Chronicle and Echo. Carly, are you there?
Hi, yes.
Good afternoon.
Hi, just wanted to ask Lucy, obviously it's early days with children being back at school, but we wanted to just know whether the initial response is good, and how they're coping, and whether there'd be any further guidance issued in the next week or so. And also, can we ask about whether there's any kind of update or change, or when we're likely to see an update on the status of area of intervention, please?
Thank you, Carly. I think that's sort of two-part question, and I'm actually going to go to Councillor Fiona Baker, who's the Cabinet Member on schools and children's services, to answer the first part, and then I'll come to Lucy on the second part, if I may. Councillor Baker, hi.
Thank you, Councillor Morris. First of all, I'd like to just put on record here of congratulating the education team at the County Council and all of the schools in the county who are all open and ready for business. Some of them have phased children coming in, particularly secondary schools, to bring their year sevens in a more orderly fashion. And obviously there have been a couple of teething problems, because children have got to get used to new ways of working, as we all have had to do. And they've had quite a long time off school. They've had 5 months out of school. So there'll be a few issues, I'm sure, just settling in. But actually, we've been in touch with as many schools as we possibly can. I myself have spoken to 2 this morning. They all feel it's going really well. The children all seem really happy to be back in the school environment amongst their friends and back in the learning place. So I'm not envisaging any problems, but we are liaising with them all the time, just in case there are. Thank you.
Thank you, Councillor Baker. I'm going to go to Lucy for the first part of that question, which was around what you did or didn't say about concerns over children. And I think you may have been slightly misquoted there, but anyway, I'll leave you to answer that one, Lucy.
Thank you, Councillor Morris. So I think obviously I'd expressed that if we're likely to put lots of people back into one environment, and particularly when we've got such a variety of school shapes and sizes, that we're likely to see some cases or potentially outbreaks. And obviously my team's been working with Fiona's team in the schools cell to make sure that we've got all of those risk assessments undertaken and that we've mitigated risk as far as is possible in all of those environments. But we are highly likely, as Fiona's alluded to see some issues arise as we get lots of people back into the same environment and they get used to those new ways of working and those new behaviours. So from a point of view of your second part of your question around the update, as I said, I'm equally at the beck and call of central government on this. We usually get an update at around 11 AM. Nothing has popped into my inbox. I've been keeping an eye on it in the background as yet. So as soon as we do have confirmation, then obviously that will be available on the Public Health England website as usual.
Thank you very much for that answer, Lucy. We move on now to Kevin Nichols. Kevin, are you there? You've got a question.
Sorry, Ian, couldn't find the unmute button.
Don't worry, don't worry.
Yeah, I think I actually sent through one about scaremongering, which I think was actually covered very well by Jonathan Nunn a couple of weeks ago. So I won't bore you by asking that one again. But I was just wondering regarding the testing facilities. I heard, in addition to the question that I've already sent in, I did overhear the oversight meeting this morning, where it was mentioned that Corby, Kettering and Northampton are in the top 5 areas for testing. I just wonder if there's any way we can get some clarification on exactly what that means. And also with regards to the testing centres in the towns that we've currently got. Obviously Northampton is going down at the moment, Kettering and Corby is going up. Is there any plans to move the Market Square site that's been erected there to somewhere else?
Thank you, Kevin. I'm going to come to Jonathan first on that and then come to Lucy, I think, to flesh out the detail. But Jonathan, if I come to you first on that.
Yeah, thanks, Ian. And just although we're not dwelling on the question, Kevin, on the scaremongering bit, we're grateful for the reporting that all media have done on this, and we hope that in return the opportunity to challenge like this will show that what you're absolutely telling people is exactly the right thing. We've no reason to try and scare people. We've just got to tell them the truth. On the testing site, there's quite a few people who don't like it on the market, actually. That's the reality of it, and I get that, and I hear that, and I visited some of them as well. The reality of the matter is that it's there for the moment, and I suppose we can't probably be any more specific than the foreseeable future. We could slip back towards that lockdown really easily, I reckon. We really could. Although we've seen the progress we've seen, it's like a ratchet. It's so hard to go one way, but really easy to slip back the other way. And from the advice that we're getting from the professionals and what we're seeing both good use of that testing centre, but also I just don't think in the wider picture we'd fulfill our obligations to the town if we hurried to try and get rid of that testing centre. So it's still there for the foreseeable future. And as much as I have sympathy and regret for those that feel their business or whatever is suffering as a result, it will still be there for some time to come, I'm afraid.
Thank you, Jonathan. Lucy, did you want to talk to the bit about the numbers and why we're so high in the sort of league table of testing, which is not a bad thing, to be honest. It's a very good thing. Lucy, over to you.
Thank you. So yes, I'd absolutely just reinforce what Councillor Nunn has said. One of the reasons that Northampton is seeing an improvement in its position is just simply because we've been able to, because of the access to the testing site, get those numbers through and identify where those cases are. And we've seen compliance be really high, so that that onward transmission is obviously therefore reduced. So it's a key tool in our toolbox to address COVID over a period of time. And it would be premature to talk about moving that site at the moment. Obviously, we've got the mobile testing units that do move, and we've got the ability to move those to areas where we have changes in incidence, or even where we have a local testing site already, such as Kettering or Corby. If we find a particular ward or borough has a particular issue, then again, we can make sure that we can just make it even more accessible, make testing even more accessible by moving one of the mobile testing units there. So it's those combination of movable and static sites that is I think, key to us successfully identifying where COVID is and getting on top of it. With regard to the actual testing numbers, we're actually provided in public health with a summary of data from the Joint Biosecurity Centre each day, and that provides us with a map, basically a heat map of the whole country as to where all of the testing rates are high and low. It is unfortunately confidential data. Joint Biosecurity Centre may be able to publish in one way, shape or form, but what I receive is sadly confidential. I won't be able to share it, but what I can say is then again today, we've got Corby at the top of the ratings nationally, Kettering second and Northampton fifth. So that's out of all of the lower tier local authority areas. We are still seeing significant numbers go through, and that's what's going to help us beat COVID locally. Last week, similarly, we had all three of those areas in the top 6. So you can see that this is a sustainable position, and while people are using those testing centres and it's helping us identify where COVID is, we'll need to continue to push those messages for onward and further use of those facilities.
Thank you very much, Lucy. Very well answered. Jack Duggan, I've got you next, sir. Are you there, Jack?
Sorry, Ian. Jack's unfortunately off today. Is it okay? It's Kevin Nichols here again. Is it okay if I ask his question for him?
Sure. Yes, far away.
Let me just find it. Sorry.
I can read it out if you'd like me to.
Yes. Yeah. I think it's actually been covered already, hasn't it, regarding guidance from the government on the area of intervention?
Yeah, it's not. It's probably worth. The question was, has there been any further guidance from the government about Northampton's area of intervention status? Lucy has already answered that, but I don't think it does us any harm to repeat the answer. Lucy.
So obviously we've seen a positive change in the numbers, and the rate overall is still higher than we would want, and certainly higher than comparable towns. So although it's good news and a move in the right direction, as Jonathan says, we can't be complacent, and we're asking Northampton residents to continue to maintain all of the good practice that we've seen. And we eagerly await obviously confirmation of the status along with Kettering and Corby as soon as Public Health England and the Joint Biosecurity Centre publish their report today.
Thanks, Lucy. Thank you very much for that. I'm going back to Carly Roberts. Hi, Carly. You've got another question, I believe.
Sorry, it's actually a separate Carly.
Oh, I do apologise.
It's
Carly O'Dell. Yes, I realise that now. It's written down as Carly Roberts here. Do apologise. Carry on with your question, Carly. Thank you.
Sorry, no, I've answered mine. It's the other Carly's, but I think it's been answered anyway.
Okay, brilliant. Thank you. We'll skip over that one then. So, Kevin, you had another question. No, we've done that one, I think, already about the testing centre moving from the town centre. So, Sarah Ward, are you there, Sarah? I'm not sure. Yes, Sarah. Hello. Good afternoon.
Hello. Yeah, I think my questions have been answered, so I'll just ask another one on a different topic. Is there any intelligence that some of the local cases are linked to people returning from overseas holidays? And is this something you're on alert for? And that's to Lucy Whiteman.
Thank you, Sarah. Lucy.
Absolutely something that we're on alert for, Sarah. One of the benefits of having that local test and trace system is that we're able to now undertake those interviews ourselves locally with contacts and with cases, and it's proving really fruitful from a point of view of understanding all of their movements in the 7 days prior to becoming infected or becoming exposed, and making sure that obviously we can then pull out themes where we're seeing either similar patterns of behaviours, similar geographic locations that have been visited, or as I talked about earlier, potentially similar attendances to areas where there may have been an exposure. It's helping us sort of piece together the jigsaw of the epidemiology for each geography. So yes, there have been some flights from abroad. At the moment, there's nothing that would form a pattern or a trend that would need reporting. But obviously, as we look at that over time, and obviously as we remain aware of different areas having different prevalences abroad, then we'll need to be able to focus messaging if we find that that becomes a bit of a challenge, or certainly poses or proposes that there are links between different areas and are returning cases from abroad. At the moment, it's very small numbers, no trends available that are of significance, but it is absolutely one of the things we continue to monitor.
Thank you very much, Lucy. That was the last of the written questions, but I think we probably have a little bit of time. If anyone else would like to ask a subsequent question, if they could put their hands up, I will attempt to come to them. Look as though anyone is asking any further questions. Laura Coffey. Hello, Laura.
Hi, hello. I've received the Surveillance Weekly report, and it says that Kettering and Corby are on the government's list of concern. Can you just clarify that for me, please?
Thank you for that question. Lucy.
So to be honest, obviously I've been in this meeting with you, so I haven't received a notification at the moment. So I'm assuming that obviously the information will have been published in a timely fashion. So we'll look into that when I'm off the call.
Thank you, Lucy. Yeah, it's very difficult to know when you're doing a press conference, keep up with exactly what's going on. Sarah Ward, you had a subsequent question. Sarah.
Can you hear me?
Yes, Sarah, hi.
Hi, this is just about the University of Northampton and the return of students. Are there any special measures being put in place around that with people coming from across the country into Northampton?
Thank you, Sarah. Lucy, that's probably one for you, is it, Lucy?
I think quite likely, yes. So again, there's been a number of meetings with the university and meetings regionally with all of the universities and the public health teams to look at how we can mitigate risk with, as you say, a number of people coming from different areas in the country to universities, not just in Northampton, but obviously in the East Midlands, we've got a number of significant size universities, which will obviously feel the impact equally, if not more than Northampton. So yes, lots of measures in place. Significant risk assessment, as I'm sure you would appreciate, has been undertaken. The university has been working with us from a point of view of understanding how to make the accommodation COVID secure. They obviously have the ability where people do wish to provide, because they have I can't remember, it's called blended learning. They have a blended learning approach at University of Northampton, so they're able to provide people with online learning experiences as well as face-to-face teaching. So there's an ability to make sure that people's attendance, physical attendance to classrooms, etc., is staggered in a way where it enables people to maintain social distancing. They're very fortunate that they have that lovely large campus where they've got very open plan facilities and they've got good open spaces between each of the buildings. So again, it enables a much more COVID secure environment to be established and maintained. They obviously also have an on-site healthcare facility and the surgery there obviously is alert to any of the challenges and they continue to work with the team. So there's a testing plan and a number of standard operating procedures in place should a single case, a number of cases or a significant outbreak be identified. So a similar approach that we've taken with our schools, but obviously sort of on steroids from a point of view of the size of the campus. And obviously the fact that there's that heightened risk with people coming from different areas of the country onto one site.
Thank you very much, Lucy, for that answer. I'm not seeing any more hands up. Laura, I'm presuming that yours is up because it was up earlier, Laura Coffey. Unless you had a subsequent question, I'll give you a chance to answer just in case. No, the hand has gone down, in which case I think that is all the questions answered. I'm going to close the meeting then and thank everyone very much for coming today. Thank you for the participating. Thank you for asking and answering the questions. I hope you all have a very good weekend. Stay safe and let's all follow the guidance and we can get on top of this these numbers in Northamptonshire. Thank you very much, everyone. Good afternoon.
Thank you. Bye-bye.
Thank you.